A state-of-the-art facility, staffed by a team of highly skilled surgeons, anesthesiologists, physician assistants, and nurses, committed to you, your care, and your recovery. The Morgan Heart Hospital at Morton Plant. From diagnosis to open heart surgery, you've traveled a well-worn road of illness, anxiety, and discomfort. It's time you started feeling better, to journey a new road, one that promises restored good health and peace of mind. In this presentation, we'll discuss your discharge instructions as well as specific guidelines which will help ensure a safe and successful recovery as you continue down the road to wellness. The first thing most patients want to know is how long it's going to take until they're feeling better. While recovery at times can seem like slow going, most patients feel much better within 4 to 6 weeks. In fact, many patients make a full recovery within 3 to 6 months. You're encouraged to look for weekly progress rather than daily improvement. Your body will tell how much activity you can handle, but by following a few simple rules, you'll experience more good days than bad during your recovery. If you're going straight home from the hospital, your home health care visits will typically begin the day following your discharge. The home health care team will contact you to schedule the first visit. If you're going to a rehab center before heading home, then the rehab center will arrange your home health care visits. Because we want to help ensure a successful recovery, you'll also receive follow-up phone calls from the cardiac surgery team here at the hospital. We'll check on your progress, answer questions, and provide advice and reassurance. While we hope you'll consider us a helpful resource in your recovery, remember that you can call your cardiac surgeon at any time should you need help or guidance. You've just had major surgery, and it's going to take some time before you're feeling like your old self again. You may feel weak, tired, and experience decreased energy. You may also experience a wide range of emotions. It's very normal to feel sad or down at times. You may also experience aches, pains, stiffness, numbness, or tingling in your incision areas. You may have mild shortness of breath, especially with increased activity. You may not have much of an appetite, and you'll likely have trouble sleeping at night. Again, these feelings are normal and may last for a number of weeks. While we encourage you to set your own daily routine, we do ask that you complete a few very important tasks every morning. These tasks will help us monitor your progress. Take your temperature and weigh yourself each morning and record your temperature and weight on the daily record which we'll provide you. Be sure to answer the infection and fluid retention questions found on the left side of the weight record. Call your surgeon if you answer yes to any of these questions. Again, these simple tasks should be completed first thing every morning, even before your first cup of coffee. Most patients find it difficult to sleep through the night for the first few weeks. Propping yourself up with a number of pillows may make you more comfortable. So may a wedge under your mattress to help elevate your torso. You may be more comfortable sleeping in a recliner or on the couch propped up by pillows. You may find it easier to sleep by taking your pain medication just before bedtime. While you're certainly encouraged to rest during the day, we do not advise that you take many naps. Too many naps will make it more difficult to fall asleep at night. Contact your doctors if you have a lot of difficulty sleeping. They may recommend an over-the-counter sleeping aid or may even call in a prescription to help you rest. Having pain is normal after surgery and could linger for a number of weeks as your body heals. Your pain should become less intense as each week goes by. Don't be alarmed if you feel pain in your incision areas, chest, throughout your shoulders, possibly even in your upper back between your shoulder blades. Manage your pain by using the pain medication prescribed by your surgeon. Managing your pain will allow you to be more productive during the day and sleep more comfortably at night. If you find that your prescribed pain medication is too strong, you can use Tylenol products for minor pain, but do not take any additional aspirin, especially if you're on Coumadin. Also, do not use any ibuprofen products such as Advil or Motrin without consulting your surgeon first. Also, staying active and completing your exercises as you were instructed in the hospital can help reduce stiffness and soreness. While some fluid retention is common following heart surgery, we ask that you be mindful of a few important symptoms and report them to your surgeon. These symptoms include an increase in your body weight of 3 or more pounds over a 2-day period, or an increase of 5 pounds over 1 week. Increased swelling in your feet and ankles, or bloating in your abdomen. Increased shortness of breath while at rest or lying flat in bed. There are a few simple steps you can take to help prevent fluid retention. First, take your diuretic or water pill as you've been prescribed. Though you may find some of the medicine's effects to be aggravating, do not stop taking your water pill without first checking with your doctor. Also, be sure to keep your legs elevated as much as possible, especially while sitting. Finally, avoid adding extra salt to your diet. Salt causes your body to hold on to water. It's okay to cook with a small amount, but do not add extra salt to your food once it arrives at the table. You should also limit your consumption of foods that are high in salt, such as lunch meat and cheeses, TV dinners, processed foods, snack foods such as potato chips and canned soups and vegetables. Sodas and sports drinks also contain excess salt and should be limited. It's important to keep your incisions free of infection. You can help prevent infection by cleaning your incisions every day with water and an antibacterial soap such as Dial liquid hand soap. Your incisions should not be submerged, so we recommend that you clean the sites in the shower, though a sponge bath would be okay. Clean each of your incisions with a separate clean washcloth. To illustrate, let's assume that you have an incision on your chest and one on your leg. First, gather 3 clean washcloths, one to wash your body and one to wash each incision. It's okay to use any color or material of washcloths, just make sure not to reuse washcloths from the day before unless they've been freshly laundered. When you shower, use a shower chair if you find it helpful and avoid using water that's too hot. Now, begin by rinsing your entire body and then washing and rinsing your hair. It's important not to let the direct force of the water to hit any of your incisions. Lather your first washcloth with antibacterial soap and wash your entire body except for your chest and leg incisions. Rinse and set the first washcloth aside. Next, lather the second washcloth with antibacterial soap and gently wash directly over your chest incision using light pressure. Rinse and discard the second washcloth. Repeat the same steps for your leg incision using the third clean washcloth. When finished, dry yourself with a clean, dry towel. Pat dry your incisions first and then dry the rest of your body. Do not wash your incisions with hydrogen peroxide, alcohol, or betadine unless instructed by your surgeon. Finally, do not apply any ointments, creams, lotions, or powders to your incisions for 4 to 6 weeks, and this includes vitamin E, aloe, and Neosporin. Do not submerge your incisions in a tub, pool, or jacuzzi for 4 to 6 weeks, and avoid direct sun exposure to your incisions for 2 months. Also, women should wear a bra to prevent strain on the chest incision and breastbone. Examine your incisions every day and report signs of infection to your surgeon. Signs of infection include a temperature greater than 100.5 degrees Fahrenheit, increased redness, heat, swelling, or pain around your incisions, green or creamy yellow drainage or drainage that is odd smelling, a change in the amount or type of drainage. Between 4 to 6 weeks after surgery, you'll be eligible to attend cardiac rehabilitation. The hospital and your surgeon strongly recommend that you participate in this valuable program. Not only will it help you complete a full recovery, but it will ensure that you maintain a healthy heart for the rest of your life. To attend cardiac rehab, first obtain a referral from your cardiologist, and then call the number on your discharge instructions to enroll. Cardiac rehab is usually covered by insurance, and your doctor or the cardiac rehab team can refer you to a program close to your home. We've covered diet, activity, pain management, water retention, incision care, and cardiac rehabilitation. Let's conclude by discussing the discharge instructions you'll receive when you leave the hospital. Your discharge instructions will be tailored specifically to you. Your nurse will review these instructions with you and give you time to ask questions. Your home health care team will also refer to these instructions as they continue with your care. You should also bring these instructions along with you to your follow-up appointments so your doctors can adjust your treatment if necessary. Let's take a moment to discuss two very important areas on your discharge instructions. The first is the follow-up appointment section. Here, we will list which doctors you are to see and when you should see them. For example, we might write, "Call Dr. Smith, your surgeon, at 727-555-7865 to be seen in 2 weeks." It is then your responsibility to call and make your follow-up appointments once you get home. You should do this as soon as possible. Typically, you should see your surgeon, your cardiologist, and your family practitioner within 1 to 3 weeks following your discharge from the hospital. The second area of your discharge instructions that we'd like to discuss is the section that covers your medication, the entire second page of your discharge instructions. In this section, we will write all of the medications you are to take after being discharged. This list will include new medications as well as the medications that you were taking before your surgery that we'd like you to resume. Do not take any medications not on this list unless instructed otherwise by your doctors. This includes all over-the-counter medications such as cold remedies, herbal supplements, vitamins, and minerals. If you have a concern about any of your medications that do not appear on this list, please talk to your nurse before going home. Along with this list of medications, you'll receive all of your prescriptions. If you are prescribed a blood thinner, such as Coumadin, there will be a chart listing the date and amount of Coumadin you are to take. You will be required to have periodic blood tests to check the thinness of your blood. Your doctor will adjust your dose of Coumadin accordingly. Once again, do not hesitate to ask any questions when reviewing your discharge instructions with your nurse. This is a great opportunity to ensure that you completely understand everything you are to do in order to continue your recovery. Should you have any major concerns about your recovery, please call your surgeon, who can be reached at 727-446-2273. This number will also be provided for you in your discharge instructions. You can also rely on your home health care team for support, advice, and encouragement. We'll be sure that you have the number where they can be reached. You can also call the patient education coordinator, who will be happy to address any concerns or questions you may have throughout your recovery. The patient education coordinator can be reached at 727-462-7824. Finally, you are welcome to contact Mended Hearts, our volunteer group, who is here to lend support during your recovery. You'll have received their information during your stay in the hospital. Please call on them as needed. As a final thought, please remember that your recovery begins and ends with you. By taking control of your recovery, by taking proper care of yourself, and by following the directions of your cardiac team, you can expect to return to a normal, healthy lifestyle very soon. Thanks for watching, and best wishes for a speedy recovery as you take the next steps down the road to wellness.